I'm Dr. Guru Sonpadve. I'm the Director of GU Oncology and Phase 1 Clinical Research at the Advent Health Cancer Institute in Orlando, Florida, and I'm here to talk about GU Oncology highlights from ASCO 2023. So prostate cancer has also seen multiple advances in the systemic therapy space, and what was presented at ASCO 2023 was an update of the TALA-PRO-2 trial. This is, of course, the randomized phase 3 trial, which looked at in patients in the first-line metastatic castration-resistant prostate cancer setting, placebo combined with enzalutamide versus talazoparib, an oral PARP inhibitor, plus enzalutamide. So previously at the GU ASCO Symposium 2023, the investigators has presented radiographic progression-free survival in all comers, in the all-comer intention to treat population. And this was reported as a positive study with improvement in radiographic PFS in the overall intention to treat population with a hazard ratio of 0.63. Now at ASCO, they presented the group with the HRR alterations, homologous recombination repair defect alterations done by genomic testing of the tumor or ctDNA. And essentially, what was found was even in the group with these HRR alterations, there was a significant improvement in radiographic progression-free survival. The hazard ratio was more impressive, 0.45 in this group for the addition of talazoparib to enzalutamide compared to placebo enzalutamide. And also, when they looked at overall survival, this is not mature, but there were some trends, but survival is clearly not mature. There was also improvement in objective response rate. So at the end of the day, given that the toxicity profile was manageable, there was some myelosuppression, fatigue seen with the addition of talazoparib. But overall, this combination is yielding improvement in outcomes, radiographic PFS in the HRR gene altered group in metastatic CRPC as first-line therapy. So these data did lead to US FDA approval of the combination of enzalutamide and talazoparib for metastatic CRPC and HRR gene alterations. And I should also mention that even more recently, there has been an approval by the US FDA for the combination of niraparib and abiraterone acetate in the first-line metastatic CRPC setting in patients with altered BRCA gene. So this is not a study that was presented at ASCO this year. This has been presented previously, but now we have this additional combination available. And even earlier, we do know that the combination of olaparib and abiraterone prednisone was also approved in patients with metastatic castrate-resistant prostate cancer with BRCA mutated patients. So really, we have 3 different combinations approved in these genomically selected patients. Now, very, very recently, in fact, today, as you know, we cannot make a slide set these days and not have a change as soon as we make the slide set. Today, there was, that is August 21, 2023, there was an announcement by a press release of the CONTACT-02 trial, the phase 3 trial, which showed that there was an improvement in outcomes for the combination of cabozantinib and atezolizumab in metastatic castrate-resistant prostate cancer in the post-novel hormonal agent setting. So again, we wait to see what this data show. The other interesting study shown at ASCO was the PEACE-1 trial. Now, this is an interesting trial which looked at patients with metastatic castration-sensitive prostate cancer, which I will call CSPC for short. And what this study was looking at was the combination of standard of care, which is androgen deprivation therapy, versus standard of care plus abiraterone, versus standard of care plus abiraterone plus radiotherapy to the primary, to the prostate. And they also had another arm of standard of care ADT plus radiotherapy without abiraterone. At the end of the day, the message from this trial is that combining prostate radiation with intensified systemic therapy, which is abiraterone, combined with ADT, led to improvement in radiographic PFS as well as castration-resistant prostate cancer-free survival, only in low-burden de novo metastatic castrate-sensitive patients. So really, this is an interesting study. It means that we should all consider radiating the prostate, in patients with low volume disease that is castration sensitive. The other interesting finding in the study was radiation therapy to the prostate also prevented serious genitourinary events, symptoms, and hematuria. And this was irrespective of the metastatic burden. So really, the authors suggested that the combination of ADT plus abiraterone plus prostate radiation should be a standard in men with de novo, low burden, metastatic castrate sensitive prostate cancer. It could also be considered in de novo high burden disease, at least for the prevention of serious GU events. So all of these data really deserve a discussion with the patient to look at to have patient informed decision making.